Hello, hello. Good day, good evening, wherever you are watching me. Good day, good evening, wherever you are watching me from. Good day, good evening, wherever you are watching me from. This is my first live event on YouTube, and today I welcome you to my channel. My name is Morolake. I'm a registered nurse. I'm presently practicing in Nigeria. My channel is all about enlightening individuals, families about health condition that they can prevent if they have knowledge about it. And mostly I use my channel for women's health. And today, what I want to talk about is preventing mother to child transmission of hepatitis B. Don't go away. Don't go away. Don't go away. Uh, should we wait for some people to join? Don't go away and kindly click on the like button so that YouTube can actually prescribe or show this live event to more people. I welcome you to my live event. Today, I'm going to talk about prevention of hepatitis B to babies. Babies born to hepatitis B positive mother. That is what I'm going to talk about today. Preventing mother to child transmission of hepatitis B. And why is this so important? During childhood age, during infancy, the baby has not actually developed their immune system to fight against infection. So it's very important as an healthcare provider that we should put all hands on deck to actually prevent and reduce transmission of infection from mother to their child. The World Health Organization aim is to reduce the transmission of hepatitis B from a positive mother to their child to less than 1%. So I'm going to tell us one by one how to prevent this and the regimen placed down in order to prevent transmission of hepatitis B infection. Hepatitis have different type from type A to E, but why are we talking about this? Because childhood transmission of hepatitis B is the most common reason whereby there is chronic hepatitis B infection during adulthood. For a baby that is for sorry, welcome to my live event. Being infected during childhood is a result of chronic hepatitis B during adulthood. Most especially, and even its complication most especially if a person is being infected during childhood, this can lead to chronic hepatitis B during adulthood. And there has been a guideline on how to prevent the transmission of infection from a positive hepatitis B positive mother to their child during their childhood. WHO have placed regimen for the prevention, so I'm blending my voice with the WHO and other healthcare worker in preventing transmission of hepatitis B infection from positive mother to their child. Most of the time, people don't go for screening. People don't go for screening unless they are doing screening based on employment screening. So it's not common for individuals to go for screening on their home, maybe in this part of world. But it's common if a woman is registered for a prenatal in a well-established facility to carry out some tests, prenatal tests, and which also contain hepatitis B screening. That is when some people will actually know they have this infection. So at this period of time, some may have high viral load. When a woman have a viral load during pregnancy, there is possibility of transmitting the infection to a baby during delivery. So in some cases, in some women, they may need to be placed on antiviral infection at 28 weeks of gestation to the time of their delivery. This depends on the test, on the viral load. This depends on how they can actually transfer this infection to their baby because of the viral load. So some certain women may be placed on antiviral drugs at 28 weeks of gestation to the delivery of their baby as a medium of preventing transmission of hepatitis B virus from a positive mother to their child. So after that prophylactic drug that can be given to some certain women at 28 weeks of gestation to the time of the delivery of their baby. Another important thing, as you are watching me right now, another thing in preventing transmission of infection, hepatitis B, from a positive mother to their child is provision and give the baby immunoglobulin injection within 24 hours of birth. So the common way and the laid down regimen is that a baby that is born to hepatitis B positive mother must have immunoglobulin injection within 24 hours of delivery. In this case, this injection is anti-hepatitis B injection immunoglobulin within 24 hours must be given to a baby that is born to a hepatitis B positive mother within 24 hours of birth. This is a passive immunity being given to the baby is passively preventing and protecting the baby from hepatitis B, and this must be given after birth within 24 hours, not to be lingered for a very long period of time. Welcome to my channel. Welcome to my channel. I welcome you to my channel. If you are joining me, I welcome you to my channel. Thank you for joining my channel. Thank you. Thank you for joining my channel. So as I'm saying, let's continue with the discussion. My live event today is all about how to prevent transmission of infection from an hepatitis B positive mother to their child. I've mentioned the first line of management is that some certain women can be placed on antiviral prophylactic drug as at 28 weeks of pregnancy to the delivery of their baby. This depends on the discretion of the healthcare provider, and this depends on the viral load of their virus as at the time that they were being informed about their status. So after that, I mentioned that the baby born to a hepatitis B positive mother must be given immunoglobulin injection within 24 hours of their birth. This is very important. This is the protocol for prevent transmission of hepatitis B from mother to their child. And it depends on different country health insurance. Most of the time, this immunoglobulin, anti-hepatitis B immunoglobulin, is not provided by government or some health insurance, but these depend on individual country. This immunoglobulin, there is need for the woman, for the family to actually plan ahead of the time of the delivery on how this anti-hepatitis immunoglobulin injection is going to be available for a baby born to a hepatitis B positive mother as a medium of preventing vertical transmission of the infection from the mother to their newborn or from the mother to their baby. So another thing is that they should not say because the baby has been given immunoglobulin injection, the baby did not need any other protection. The baby must also have the normal routine immunization schedule. The vaccine against hepatitis B, the routine immunization schedule should also be given to the baby that is born to an hepatitis B positive mother as a medium of preventing transmission of infection from mother to baby, from mothers that are hepatitis B positive mother to their babies. This is very essential. So, an hepatitis B foundation has actually confirmed statistically that by following this method, by giving the baby immunoglobulin, anti-hepatitis immunoglobulin, after the delivery within 24 hours, has able to reduce the chance of the infection passing from the mother to their baby at 90%. I think this is a higher rate. But by giving the baby at birth anti-hepatitis immunoglobulin injection and also combining it with the routine hepatitis B vaccine schedule, this has an higher chance of preventing the baby from hepatitis B infection. And this is statistically that the chances of the baby having hepatitis B is reduced to the chances that the baby cannot have hepatitis B is at the rate of 90%, and this is a good rate. If you are joining me, welcome to my live event. This is my first time going on live on YouTube, so this is my first time. If you are joining me, I welcome you to my channel. Like I mentioned earlier on that I'm talking about how to prevent transmission of hepatitis B infection from positive mother to their newborn during birth, and why is this matter? The reason is that during childhood, the baby does not have immunity to fight on their own. Their immune system is low, and most chronic hepatitis B infection or complication that arise from hepatitis B is as a result of people that have been infected during their childhood age. That is why we must not overlook it. And there is guideline concerning that in prevention of hepatitis B against children during the early stage of life. And research statistically has shown that the chances of having this infection has been eradicated to 90% according to Hepatitis B Foundation. So I'm lending my own voice to WHO in preventing vertical transmission of infection from mother to their child during infancy, during their early childhood. This is very important. This is economical, this is safe if they are being prevented, and when children are being prevented from this infection, it prevents complications that can arise in their adulthood from this infection as well. So mothers that are hepatitis B positive, come closer, let's discuss about this. So I'm going to go about this again. If you are joining me just now, so that I'll be able to recap what I've discussed about, and you can actually make your comments. You can actually make your comments, which I will reply to. If I can reply to it now or later, because this is my first time of going on live on YouTube. So this is an awareness. I want you to share it with others. This is an information. Information is key, and information is very important in preventing this infection, and is essential to prevent the young ones from infection that can actually cause harm to them later in life. This is very essential. If you are joining me on my live program on YouTube, I welcome you to my live program. I welcome you. I welcome you. Welcome to my live event on YouTube. Welcome to my live event. And don't forget to like my video so that YouTube can actually prescribe it to more people, so that YouTube can allow more people to see this. And who knows, maybe people that are going to benefit from it, they are going to come across it and have access to it. So don't forget to like this video. Don't forget to like this video. Today I'm talking about preventing transmission of infection from mother to childhood. I'm talking about the prevention of hepatitis B from a hepatitis B positive mother to their newborn, to their child during their childhood age. And why is this important? Because their immunity has not actually developed to fight against any infection. And why does it matter? Why do we need to talk about it? It's because being infected during the young or earlier childhood age is the result of chronic hepatitis B infection during adulthood. And the regimen in preventing this infection, number one, is through prophylactic antiviral infection from a woman that is newly diagnosed during pregnancy. If she has an high viral load, there is possibility of transmitting that infection to another person. There is possibility of transmitting that infection to a baby during delivery. So in some certain women, they may be placed on prophylactic antiviral drug starting from 28 weeks of their pregnancy to the delivery of their baby. Another key point is giving of antihepatitis immunoglobulin during within 24 hours of birth of the baby. A baby that is born to hepatitis B positive mother must be given antihepatitis B immunoglobulin within 24 hours of delivery. Irrespective of that, the routine immunization schedule, the hepatitis B vaccine that should be given to the baby as birth should be also be given to the baby. Subsequently, the next appointment, the woman must keep the next appointment to complete the hepatitis B vaccine for her baby. The immunoglobulin hepatitis injection that is given during birth is a passive, it convert passive immunity to the baby, and it's a short-acting one. So irrespective of, even if the baby is given about hepatitis B immunoglobulin during birth, there is still need for the baby to have the normal immunization schedule routine for hepatitis B vaccine for children during childhood age to confer a long-term prevention, to confirm a long-time prevention of hepatitis B in them. There is need to complete the doses of hepatitis B vaccine, routine one. And statistically, it has been shown that if all these regimen is being followed, there is chances of preventing this infection at the rate of 90% statistically. So, thank you for staying with me to the end of this video. I've come to the end of this video. Don't forget to like, don't forget to share. Until next time, I will be doing another video. Take complete charge of your health. Bye for now. Bye bye.